What if you could use hypnosis to reduce stress and facilitate healing in the body? I sit down with Penny Chiasson, a former nurse anesthetist turned hypnosis expert. Penny breaks down the science behind hypnosis, explaining how it works to bypass your critical mind and access the subconscious, where real transformation takes place. Learn how hypnosis can help you manage pain, reduce stress, and unlock your body's innate ability to heal. From stressed out nurses to those battling chronic illnesses, Penny has helped them find peace and balance in their lives. Stay until the end as she guides you through a powerful breathing technique that you can start using today to help anchor relaxation and calm into your daily life. You're listening to the Born to Heal podcast, and I'm your host, Dr. Katie Deming. After 2 decades of practicing as an oncologist and caring for thousands of patients, I've seen firsthand how our healthcare system places obstacles in your path to true healing. My guests and I will bridge the worlds of Western medicine and alternative healing to help you achieve optimal health. Expect to uncover new insights, share a few laughs, and maybe even shed some tears along the way. But most of all, we'll learn how to heal from within together. So let's dive into today's episode. If hypnosis works, does it really mean that the illness is only in someone's head?
Absolutely not. As a hypnotist who's done thousands of hours of hypnosis and hypnotherapy sessions, it's more about the perception of what we're experiencing. We can have a true physical issue going on, and through hypnosis, we alter the perception of it. It does not mean that it is not there.
So it doesn't mean that it's not real, but hypnosis can be effective because with hypnosis, you're altering that person's perception of the illness or whatever's happening in their body.
Correct. Hypnosis has been successfully used to completely block pain for surgeries. And surgery is very real. We know that that's a very real injury, but you can use hypnosis to block that. And personally experiencing the blocking of pain or analgesia through hypnosis was the deciding factor that I became a practicing hypnotist, because that was never my plan. I took the training out of curiosity to learn more about what I had found in the medical research working as an anesthetist. But in that training, one day the instructor called up a volunteer who happened to be me, and he guided me into a deep state of hypnosis. He gave me suggestions that I was completely numb on the back of my hand, and he clamped a surgical clamp shut on the back of my hand. So tightly, in fact, that it left the mark on my skin for 2.5 hours, and I never felt a thing.
Wow. So that was your first introduction to hypnosis for pain.
Yes, that was day 5 of my basic hypnosis certification training. And I walked out that day. I called my husband. I said, "Hey, honey, guess what? I'm opening a hypnosis practice." And he was like, "What the heck? What?"
That is an amazing story. And so you really initially went in, this was a training to kind of add on to your practice as a nurse anesthetist. And then this became something where you realized, wow, there's real value here. And I want to be able to add this. Was it initially adding it to your practice as an anesthetist, or?
Well, I wasn't sure what I was going to do with it. In 2008, there was a sentinel event at our hospital where there was use of a benzodiazepine alongside of a narcotic, and there was a bad outcome. And I realized as a nurse anesthetist, I learned a lot about pain that I didn't as a nurse. So this was my first entrepreneurial hair. I decided I'm going to create a CE course for nurses. And when I began looking at sedation scales, and I'm like, okay, well, what if someone is sedated, but they're still having pain? Like, what can nurses do? So I went down the rabbit hole of complementary and adjunct techniques for pain management. And that was where I uncovered the actual medical research around hypnosis and pain. It's actually one of the most highly studied areas of hypnosis. So it was always in the back of my mind And then in 2012, I came across an advertisement for hypnosis certification by a retired nurse anesthetist. And you and I both have been through credentialing process. So knowing where you're getting your training from is important. So I opted to go to that hypnosis certification and was just going to get some anesthesia credits, learn a little bit more about it. I was literally just hypno-curious, as I like to call it.
I love that. And so tell us, can you tell the audience what is hypnosis, and how does it work?
So hypnosis is really just a state of focused attention, and a little bit more technical description of it would be so that we can bypass the critical factor and receive suggestions for change that we want in our life. The critical factor is basically the analytical, critical thinking part of your mind. So basically, you go into a state of focused attention where you're not actively thinking and questioning everything, and you allow yourself to receive suggestions, or you give yourself suggestions for what it is that you want to change, see differently, be open to in your life, be it beliefs, habits, or behaviors.
And how exactly, what is happening through hypnosis? What is it that you're, accessing to help people, move past that? Did you call it the critical mind?
The critical factor.
The critical factor. How does hypnosis work to get people past that?
That's a very good question. And I'm going to tell you that no one exactly knows. People are still attempting to figure out exactly how hypnosis works, exactly how one bypasses that critical factor. But we tend to be more in our right brain when we're in hypnosis, and the limbic system of the brain is more active. And that's basically the area of the brain where we access memories, where our imagination is, where we determine our state of well-being, right? Should we be in fear? Are we safe and secure? So all of those things come into play there. And that is then interconnected to how our body responds to our environment. So they do know that when we're in a hypnotic state, we are more suggestible. They don't understand the exact mechanism. And we're also influencing this part of the brain that accesses our memories, our anticipation, our emotions, and determines our state of well-being. And it's believed or hypothesized that that's where some of the influence comes in as to how we respond and react to stress and healing.
Right. And when you say that part of the brain that accesses memory and these other pieces, is this the subconscious that you're speaking of when you say that?
One could say that memories are a part of the subconscious. If we think of the subconscious as the part of the mind that processes our experiences and puts perceptions into place and how we interpret our world, this is my definition. I'm not a scientist, but my definition of the subconscious is it's that part of our mind where we are perceiving, interpreting, and responding to the world. So all of those things do come into play there. A lot of people will say it's the conscious mind and it's the unconscious mind. I tend to look at it from the medical model, where it's the conscious, the subconscious, and the unconscious, with the unconscious part of the mind being that automatic part, our reflexes, our heart rate, our breathing, the things that aren't under the influence of our perceptions.
Got it. I think it's helpful just because on this podcast, we've talked about the conscious mind and the subconscious mind. And you're bringing up something, that we haven't talked about before, which is the unconscious and the reflexes and the breathing. And so in the unconscious, from the way that I think about that, is that's the stuff that we never even need to think about. It just happens reflexively. Our body is designed to do the things that it needs to do, like your heart beats and we breathe and we have reflexes that pull us away from pain. All of those things are unconscious. When you're talking about hypnosis and the influence, does it influence the unconscious mind as well in addition, or?
Yes, it can, because when we have a classically conditioned habit, then that is within the unconscious mind. So what hypnosis will help us to do is to create a new neural pathway and a new habit that will overtake that classically conditioned habit. The other piece is there's something called the reticular activating system. And the reticular activating system is in this reptilian part of the brain that is in the unconscious mind. And it has a pure purpose of survival. So what the reticular activating system does, first of all, when you're asleep and something goes bump in the night, it's the guard dog that has one ear cocked up that wakes you up when there's a bump in the night. The other thing that it does is it takes the information that we process visually and through our hearing, and it helps our subconscious mind to prioritize the information that we believe is essential to our survival. This becomes very important when we are dealing with illness and with healing, because if we speak to ourselves in a way that we are creating the expectation that good things are going to happen, then we have that glass half full, basically. We can receive a lot of information, but the information that is going to filter through that critical factor and is going to come into our awareness and perception is going to be the information that supports our state of being. If we have a glass half empty approach, someone could come to us and they could give us information around a treatment or a diagnosis that's 90% positive. But if we have talked to ourselves in a way that we've programmed the subconscious through the reticular activating system to look for the negative, that 10% is what's going to stick. So that is how the unconscious and the subconscious work together just for our basic well-being and state of survival.
Okay, I think that that's really helpful to understand that basically what you're doing is the reticular activating system takes in sensory information, like you said, visually or auditorily, and then it prioritizes what is necessary for our survival. And that's kind of born into us. And then also by our conditioning of how we were raised and everything that we've experienced. But what you can do with hypnosis is shift that prioritization so that we're not always looking for the negative per se. And so by shifting that perspective, then you start to see more of the glass half full versus the glass half empty. Do I have that correct?
Yes. And you don't even need hypnosis to do that. Our self-talk in the way that we talk to other people about our problems and their problems, because the conscious mind can only process 7 to 9 bits of information a second. Think of a phone number. You can pretty quickly memorize a phone number. If I were to give you an 18-digit number, that would be a little more challenging. Some people who've really trained their mind could do it. Most average people wouldn't be able to. The subconscious takes in and processes 20 million bits of information or more per second. If we had to actively be aware of all of that information, we would exhaust our brains, and then we wouldn't be at the ready if we needed to protect ourselves, because that's all our brain cares about. How am I going to survive today? So the reticular activating system tells the subconscious mind, we are basically looking for confirmation bias around this particular subject. This is why 3 people could watch the same news channel and watch the same piece of news and have 3 completely different interpretations of that news, because we have different filters based on the conversations that we've had, the perspectives that we've taken, and our beliefs around that.
Yes. And we know this actually from in crimes. When a crime happens, you'll have eyewitnesses who are all there and document different experiences for exactly this reason of what you're describing. It's our perception. And I love that you've broken that down to really help people understand what is happening there with the reticular activating system, and that it's a way for us to not exhaust ourselves by paying attention to everything all the time. It pays attention to the things that we, in our own personal experience need to pay attention to, because those are the things that have threatened our survival in the past.
I mean, it's truly an instinctual mechanism, because there was a time when we were hunter-gatherers and you had to know what it sounded like when a deer was walking through the woods, because that deer may mean the difference between you starving to death and you surviving the winter. So it's a very primitive mechanism. But what has happened is, in this day and age where we're constantly being bombarded with information and expectations and judgments and all of these things, this part of the mind can't tell the difference between what's true life or death and what's of perceived importance for us to fit in and be a part of the tribe, which is part of our survival. It actually influences our identity to a degree.
Yeah, well, and actually, I love that you just brought up identity, because I would like to talk about this, about identity as it ties to people who are dealing with illness. And this is something that for me, I've been really interested in. And actually, with my TED Talk, with talking about Survivor, I talk about the potential dangers of language. But actually, the one thing I didn't talk about in that talk is identity, which is huge. So I want you to talk about this, talking about the identity of someone who is sick and what we can do around identity to have more empowerment and also more powerful outcomes.
Yeah. So identity is basically our beliefs. It comes down to our I am statement. I am healthy. I am well. I am a healer, or I am dying. So it really plays a role, because remember I spoke earlier about the limbic system and our emotions and our survival. If our beliefs and our identity is of something that is not aligned with our health, our wholeness, our wellness, our thriving, it's going to activate the fear centers of the brain. It may be at a very low level that we don't realize it, or it could be at a very intense level in the case of someone who really worries and they're experiencing anxiety and panic attacks. There's a whole continuum. When we activate the fear centers of the brain a little bit or a lot, we are getting activation of what some people refer to as the psycho-neuro immunological axis. And all that means is a big fancy word for how our thoughts, beliefs, mental and emotional health impacts the way that our brain regulates our hormonal and our immune states. And stress is a good thing. If we are driving down the highway and all of a sudden someone cuts us off and our car goes off the road and we're injured, stress is a good thing. It immediately kicks our body into survival so that it can protect itself from infection and injury and all of those things. Chronic low-level stress actually impedes the ability of the immune system to function properly. It causes us to experience stress all the way down to the cellular level. And that, of course, as you know, is where cancer comes into play. There being an impact at the cellular level that cells are not reproducing properly. So when we look at our identity, if we are identifying as someone who is healthy, if we're identifying as someone who heals their body, who can be whole, then we're taking the fear out of that. We're decreasing that stress response. And when we decrease that stress response, we create room and space within the body for the body to create its own healing. And I have to really, from an ethical point of view, be very clear that hypnosis in and of itself does not heal, treat, or cure anything. It creates the space and the opportunity within the body for the body to heal itself. And it may simply be, take someone, for example, who might have been told they're in a terminal state. And you might think, well, Penny, I am dying. That's what they told me. I am dying. Well, maybe your body is having a challenging time overcoming and healing, but you can still be someone who says, I am living. I am living right now. I am living in this moment, and I am present, so that you can take that and create that peace that allows your innate healing abilities to take over.
I'm like, yes, yes, yes. People can see me over here. I'm like, this is it. So I've talked about this a lot, that actually a state of peace is where the body heals itself. Like, we're designed to heal and our bodies are designed to do this, but we have to create that sense of peace. And I love what you're saying here is that identity is one way that we either move away from that peace because we allow the fear response. And honestly, I think for people with cancer or other chronic illnesses, but cancer is the one that I've spent the most time around, fear is like the ever-present companion. And, I remember saying to my mom at one point when she was sick that, fear, if we can mitigate this fear, if we can help you start to lessen it, it really will help your body. And she said to me, it's normal to be afraid. I have cancer. It's normal. And I think what I want people to understand in this conversation that we're having today is that it can be normal. And also there are ways for us to shift it. Yes, it's normal for people to experience fear with cancer. And we don't want to stay there, because just like what you described is that when we're in fear, it's affecting our cellular functioning of our body. And so I love that identity is a way that we can shift away from that identity of illness and identifying with the fear and embodying, even if it's just in the moment. And the truth is that all of us have, the only thing we have is right here in this moment. And I love that I'm living. I'm in this moment, I'm alive. And there's so much power to that. So let me ask you this. What are some of the ways that someone can shift their identity? You talked about self-talk, so the things that we're telling ourselves, and like you just said, the way that you're speaking to yourselves, but how would someone go about shifting that identity?
I think that's a great question, because there are many ways that we can tap the subconscious. And the subconscious is going to be the fastest way to do that. What I would do, and I take my clients through this. I ask them what it is that they want. What is the benefit of the change? And then I'll ask them, if you already believed this, who are you? And the answers that may come through are, I am joy. I am peace. I am a loving mother. I can trust myself. So some beliefs begin to come through there in the I am. Some people will have funny words that they use for themselves where they identify with the energy, the courage. So it might be, I am courageous. It might be, I am brave. When you have those statements down, I am, then say, okay, if I am joy, what do I believe? If I am joy, I believe I can find happiness and pleasure in the smallest of moments. I believe I can be present. I believe that no matter what happens, there's always something good in it for me, that only good comes to me. When you write these things down, you want to really lean into the feeling of it. Before we hit record, you and I were talking a little bit about emotion. Emotion is a way to tap right into the subconscious. And sometimes when we write these I am statements or I believe statements, sometimes they feel a little bit out of reach. So I like to have people start general, where I believe I can decide to be healthy, or I believe I can allow my body to begin to heal. That's a very general statement. We're not getting really specific. And then script or write out those additional statements. And as you write them down, I am joy. I am peace. I enjoy the special moments in my life. I enjoy the average moments in my life. I can find appreciation in everything. You feel how that energy changes through that process. We want to bring that energy in, and that emotion will begin to help create a positive association between those statements, because our mind likes to move away from pain and into pleasure. So we're also tapping into that piece of it. And then every day, read your script that you wrote. And if you want to change it, adapt it, play with it. It may become more and more specific as you go. But that is a very good beginning. I only say positive and helpful statements to myself.
This is such a powerful exercise to do for anyone, actually, is to, and I love that you mentioned this about the emotion, that really tapping into the emotion, and this kind of stair stepping too, that sometimes it feels out of reach to say, I am healed, but you can stair step, like you said, I believe it's possible for me to heal, and get yourself to that place where you have the very powerful I am statements that sometimes it takes us working our way up to those really bold statements, because you don't want to pick a statement that feels so untrue that you feel uneasy about it, because it's basically the reverse, right? You're doing the opposite of what you want.
Yeah, you just literally triggered that protective mechanism that goes, this is BS.
Yeah.
This is BS. You're drinking the Kool-Aid. Yes, we're going to drink the Kool-Aid, but we're going to tiptoe into the water.
Perfect. So I think that this exercise could be very powerful for whatever you want to create. So we're talking here specifically about illness, but it could be about whatever you want to create in your life, using these I am statements and then anchoring it with that emotion that really anchors that I am statement into our subconscious through the emotion. It's beautiful.
I was going to say a really easy hack. If you're someone who you think you might forget to read through those, set reminders on your phone and label the reminder. So when the reminder pops up on your phone, it's just right there. I am healing. Every day I am stronger. Whatever it is.
Beautiful. Yeah. And I know some people who put it as the screensaver on their phone. They'll like kind of write it out and then, snap a photo of it, and it's at their screensaver. So every time they turn on their phone, they see it there as well. So I love that of having the reminders. And, I'd like to talk just quickly. One of the things that I find when I talk to clients about hypnosis is sometimes they get nervous, like, what is this person going to program into my mind? And I'm wondering, can you talk about with hypnosis, are you putting someone out? Are you putting them under? Is someone going to adopt beliefs that don't fit with what they believe? What is that process? What's happening there? Just to alleviate people's fears so they understand, if they were to work with a hypnotist or if they were to do hypnosis audios, what is happening there? And how much control do they have over what is taken in?
Yeah. So once again, it's that state of focused attention. And you will hear, if you're working with a hypnotist, you'll hear everything that's said to you. I have explained to clients in the past, you're not going to be out, you're not under, you hear everything that I say. If at any time you need, because I work virtually with clients, I don't see people in person in office. I'll tell people, if someone comes and rings the bell, you will be able to safely get up and answer the door. Or if you need to go to the restroom, you can safely get up and go to the restroom and come back, and we'll pick up where we left off. And it never fails that frequently I'll have someone after the fact, they're like, but I'm not sure I was in hypnosis. And I'll say, what do you mean? Well, I heard every word you said. I'm like, yes, I told you you would hear every word that I said. And that just goes back to those preconceived notions. When you're working with a professional hypnotist, they are going to give you suggestions around the desired outcome that you have. We have normal states of suggestibility where we pick things up all the time. Hypnosis is just choosing to go into a more focused, directed state to receive those suggestions for change. And there are a lot of different techniques. Some, it's just script based, which is what hypnosis audios are as well, where you're just receiving suggestions for well-being, maybe for being more optimistic, for sleeping better. And then there are more advanced directed techniques, which include root cause work, emotional release, forgiveness, which is huge. Anger is a big emotion that plays a huge role in disease in the body. So there are more directed techniques. But typically, when you're working with a professional hypnotist, they're working by a code of ethics. There's a standard of practice. And as long as that person is certified and trained, you're going to be in good hands.
That's great. And I think just from myself, so I have experienced hypnosis and have found it very powerful as a technique. And, all the way from just listening to pre-recorded audios to having customized hypnosis sessions, and then the audios that go with that to, listen to them over time. And it's been very powerful in my own life. So I definitely value this tool for people and want them to understand that it's safe, that, they're not being put out and having these things kind of programmed into them that, are not desired or wanted. And I love that you said that you're going to hear the things. And if something happens, of course, someone, when he's going to listen to a hypnosis audio while they're driving or operating machinery. Please don't do that. Driving a car, please don't. But that you can hear things and that you're aware. It's just kind of taking you into that state where you're suggestible and able to incorporate these new concepts and ideas and beliefs into your subconscious. So I know that you have a technique for anchoring the relaxation response. And I think this would be really helpful for my audience to have a tangible tool that they can use. Can you tell us a little bit about how you've used this and how this tool has helped? I know that you've used it with other nurses that you work with, and then maybe you can walk us through the exercise.
Yeah, so the relaxation response can be activated through breathing. And there's actually a book called The Relaxation Response by Dr. Herbert Vinson. He's out of Harvard, and he wrote about this in the 70s. And when he went on the news circuit to talk about it, he was actually dismissed because he started talking about how yogis, through breathing, could really slow down their heart rate. So that was just a little too forward thinking for the medical community at the time, but now he has his own cardiology center at Harvard. So it just goes to show how times change. Basically, we have a nerve in our body called the vagus nerve, and it has nerve endings in our abdomen, our diaphragm, our lungs, our heart. And basically, it regulates our blood pressure in tandem with our breathing. So by using a specific breathing technique, we can stimulate our brain to activate the relaxation response, which lowers our blood pressure, and it lowers our heart rate, and it lowers stress chemicals in the body. And it also results in the release of endorphins, serotonin, and melatonin, which is all very good for us. So the way that you do the breath, most people, when they take a nice deep breath, and you ask them to take a nice deep breath in, they're going to and throw their shoulders up and back. But that's not what we want to do in this case. When we breathe in, we want to breathe down into our abdomen so that when you breathe in, you actually feel your stomach go out. Some people like to put their hand on their stomach. And what I'm going to ask you to do in just a moment is to breathe in for a count of 3. To hold it for a count of 3, and then to exhale for a count of 3. But we're going to go nice, slow, and deep. In, hold it, and exhale. Now, this time when you do it, I want you to take your thumb and finger. When you inhale and when you hold it, I want you to pinch your thumb and finger together firmly. When you exhale, I want you to release. So we're going to breathe in. Let's do that 2 more times. And 1 more time. In, 2, 3. Hold it, 2, 3. And exhale, release, and let it out. Okay. So Pavlov's dogs ring a bell. Dog salivates. Most people have heard of that. The breathing and the relaxation is like the salivation. Pinching the thumb and finger together is the ringing of the bell. So we're associating the thumb and the finger with the breathing. Now, to anchor this in very quickly, I would like to guide you through a relaxation exercise. So if you were driving, if you're out riding a bike, walking the dog, if you're watching kids or you have food on the stove, just please come back and listen to this part later. But if you would, just go ahead and take a nice deep breath in, let it out, and close your eyes. And as you do, just focus on the natural rhythm of your breath. And as you focus on the rhythm of your breath, just notice how it feels as your chest expands and relaxes. And the oxygen moving in through your nose and down into your lungs. And then the feeling of the warm air as you exhale. And take your attention to your arms and notice the feeling of the sleeves on your arms. The light touch, the warmth, the texture. And as you focus your attention on that sensation, your mind begins to relax. And as your mind begins to relax, you become more aware of your hands, your breathing, the way that your feet are resting. And tuning to the sound of my voice, focusing only on the sound of my voice. In just a moment, I'm going to once again take you through this breathing exercise. But with each instruction that I give you, you find that you become more and more focused on the sound of my voice. It's as if everything outside simply begins to fade to the background, because you know that you're doing something here for yourself that will help you to be more relaxed, more calm, and more at peace, and allow your body to create a chemical state for healing. So once again now, I want you to pinch your thumb and finger together, breathing in, 2, 3. Hold that breath, 2, 3. Now release your thumb and finger as you exhale. Beautiful. Once again, your thumb and finger together as you breathe in, 2, 3. Hold it, 2, 3. And release as you exhale. And one more time, breathing in, 2, 3, pinching that thumb and finger together, holding it, and now releasing, feeling that relaxation move throughout your entire body. And 2 more times, pinching the thumb and finger together as you inhale, 2, 3, beautiful, holding that breath, and exhale. And here we go one last time, your mind developing a memory as you pinch that thumb and finger together, 2, 3, holding it, 2, 3, and releasing as you exhale, 2 and 3. Every hour, if you like, take 2 or 3 of these nice, deep, controlled breaths, pinching your thumb and finger together and then releasing. And very quickly, within a day or 2, or maybe a little longer, 3 or 4, you will begin to notice that your mind, your body easily relax each time you take these breaths. And within a week or 2, you might simply be able to pinch your thumb and finger together and experience the same deep relaxation without having to take the breath at all. Because it's amazing how the body has memory, how the unconscious mind has memory. And each time you listen to this, your unconscious mind is associating your thumb and finger pinching together with the relaxation from this breath. Whenever you're ready, just open your eyes.
That was wonderful.
Oh, you're welcome. The key to this is every hour or every couple of hours, just take 3 or 4 of these breaths. So it takes 1 minute to take 3 or 4 of these breaths, pinching that thumb and finger together, and you condition this. And I found this to be very helpful when I worked with nurses who were stressed. I would take them around the corner and I would teach them the breath. And then what would happen if they got into a tense or stressful situation on the floor with the doctor, with the patient? Things get a little crazy in the hospital. They would be shocked and amazed that they could simply pinch their thumb and finger together and it would just feel like a wave of relaxation come over their body because their brain became conditioned to release those chemicals when they did that.
That is so powerful. And I'm so glad. Thank you so much for sharing that practice with us. And yeah, I'm definitely going to practice that because, and this is something that I think is really important, especially for those listeners who are experiencing illness, is finding these simple techniques that you can calm yourself in the moment. So thank you so much for sharing this. And thank you, Penny, for being here with us today. I'm wondering if people want to find more about you, where can they find you?
Well, I'm over on Instagram at penny.chiasson. I'm on Facebook as well, Penny Chiasson, or they can go to the website, pennychiasson.com. I have a podcast there. You can listen and just get to know me better.
I love it. And can you spell your last name just so people know how to spell that?
Yes, because it's not spelled the way it sounds. Chiasson.
Well, Penny, thank you so much for being here with us today. It was a privilege and a pleasure to chat with you. And I know that our listeners are going to enjoy this episode. So thank you so much.
Yeah, thank you for having me. I really appreciated the conversation.
Thank you for joining me on Born to Heal. It's been a privilege to share this time with you. And I hope that today's episode has offered you valuable insights on your journey toward optimal health. Please consider subscribing, sharing this podcast with your friends, and leaving us a review. To learn more about how you can work with me, please visit katiedeming.com. You can find additional resources in the episode show notes linked below, and remember to join us next week as we continue to explore more holistic approaches to healing. Until then, this is Dr. Katie Deming, reminding you that just like me, you were born to heal.